All right, good morning. Much appreciation for everybody who's able to join us today in our panel review. Today on deck, we have Umatilla and Marion. And so I first want to start with a big thank you to Ariana, who's really carrying the load of preparing all of our materials, and it really facilitates making the conversation. Thank you, Ariana. Appreciate you. One of our partners has been down with the flu, so we miss her, and thank you to Ariana for hopping in. So I want to welcome everybody again to the Drug Treatment Recovery Services Fund review panel. Our job is to review all of the applications that have been submitted for Measure 110 behavioral health resource networks in every county across the state. And I would like to take a moment and celebrate that we have already approved 26 out of Oregon's 36 counties. So yay, we're more than 2/3 of the way there. And thank you for being willing to come on back. So I want to pause for a minute and I'll have Carly take attendance and then we'll move into the regular flow of the day. Thank you.
Amy.
I'm here. Couldn't get the button.
Dharma. Keisha.
Yeah.
Hey, Keisha. Morgan. Ron.
Ron's here.
Hey, Ron. This up is Al. Abby.
You too.
Ariana.
I'm here.
Ane.
Hi, I'm here.
Hey. Dana.
Good morning, I'm here.
Good morning. Daniel.
I'm here.
Hi, Daniel. Danielle.
Here.
Hi, Danielle. Drew. Elizabeth. Emily.
Here.
Hey, Emily. Evelyn. Grace. Gregory.
Here.
Hey. Greta.
Here.
Hannah.
Here.
Judith. Juliana.
Here.
June.
Here.
Kathy.
Here.
Kirsten. Liz.
Here.
Mark.
Here.
Maya.
Here.
Megan.
Here.
Nicole Egler.
Here.
Rachel.
Here.
Sam is not here. Sarah Adelhart. Sarah Hubner. Sean.
Here.
Stanley.
Here.
Tammy.
Here.
Tatiana.
Good morning, I'm here.
Good morning. And Tim.
Here.
We have quorum at 27.
Amazing. I appreciate it. Let's get rolling then. I need to find the right materials so we can share screen. And too many windows open. Here it is. So I know we've been trying to do alphabetical order whenever possible, but I know in our communication, we've had Umatilla coming next for quite a while. So I want to do that first and honor the fact that you've had those slides for longer than others, and then we'll jump into Marion, which I sent early this morning. So let me present and share. Go, Amy, go ahead.
With Umatilla County, I have an actual conflict and I've never had one before. So if I have an actual conflict, what do I need to do?
One moment while I pull up that slide to tell you
Sorry.
exactly what you need. No, don't worry. I love it. You're always just a couple of steps ahead of me. Okay, so here's Umatilla County. And we'll start with our call for conflict. So just to get everybody on the same page, Boulder Care Community Counseling Solutions, Eastern Oregon Center for Independent Living, or EOCIL, Life's Intentions, and Oregon Washington Health Network are the 6 providers. And if you have an actual or potential conflict of interest, please speak it now. Amy already did. So with an actual conflict of interest, you must announce the nature of the conflict and refrain from participating in the discussion, and please turn your camera off.
I'm a board member of Life's Intention LLC and the director of programming, also with Oregon Washington Health Network. We work close together with them. So
Okay,
2 actual conflicts.
thank you for sharing that. And then the last piece of information is if there are not enough members to vote on the proposal, members with an actual conflict of interest will be asked to vote in roll call order until a majority of folks. So we'll figure out what we are with that quorum. Thank you, Amy. Any other actual or potential conflicts of interest with any of these applicants or providers? Okay, hearing none, we're going to move on. And before I do, hold on, sorry, I'm going to try to multitask here and pull up my note, which I can't because it's under the screen, but that's okay. I just want to make sure I give you all a queue of the 5 questions you need to answer, hopefully succinctly and rapidly, so we can get through multiple counties today. So just a reminder for everybody that we received 331 applications that were all reviewed at least twice. So that was 662 reviews. That is a lot. And we are coming together here to make final funding recommendations to the Oversight and Accountability Council. And actually the OAC will be meeting later on this afternoon to begin that, to continue that voting process. So just to be clear, the Oregon Administrative Rule states for the review panel that once all the applications have been evaluated and reviewed, the SCORE panel may meet as many times as is necessary, must provide final funding recommendations to the Oversight and Accountability Council. The review panel must, to the greatest extent practicable, recommend at least funding applicant in each service area in each county. And our goal is for each of the 36 counties, we must complete a successful majority vote on funding recommendations to the OAC when building behavioral health resource networks. As a reminder, I'm going to actually minimize this so I can pull up my notes and share them with you all. As a reminder, this is a public meeting and we are recording currently. And please, however you can, just raise your hand and lean into the conversation rather than putting anything substantive into the chat. We will make sure that we use the chat for any like I gotta goes kind of things like Daniel just did, thank you. And then also make sure that the motions are captured accurately in the chat. I know we have a lot together to cover, so however possible, when I can actually open this note and give y'all kind of a cheat sheet for, oh, there it is, it's behind the screen, for the questions that y'all need to answer for your applications. Please be prepared to do a concise summary so we have a clear understanding and without reading each of the full application responses, which you already have done. Here are those questions incoming. Great. Okay. At the end, of course, we much prefer that the reviewer share the information, but if needed, the Measure 110 team is prepared to lean in and pull open the narratives as well as the budget to help answer these questions. And the OAC voted on October 9th to use the funding formula as a guideline for making decisions. So these really are the parameters through which we work to ensure that the funding recommendations are as much in line as possible today, with those numbers in the yellow along the right side column. Okay, I'm going to make this big again since I got my questions up. Umatilla County, located in northeastern Oregon, is known for its diverse landscape, which includes forest, mountains, and agricultural land. 2020 census showed 80,000 people living in the community. And the Confederated Tribes of Umatilla, the Indian Reservation, is within the county and covers 271 square miles. County seat is Pendleton, a town famous for its Western heritage and the Pendleton Roundup Rodeo. The population is predominantly white, however, with a significant Latino or Latina, Latina or Hispanic population, which looks about 30%. It's pretty significant. And agriculture plays a major role in the local economy. The county offers a mix of urban and rural communities. Poverty rate is almost 19%. Median household income is $60,000. Here you have the age distribution, and the intellectual disability rate is under 14% for folks under 65. Low to moderate income is 33% of households, and the employment rate is 3.6%. Of the 6 applications received by the providers listed here on the left, the total, all of them passed the minimum scoring requirement. The total countywide formula shown in the yellow column on the formula page is just shy of $10 million. Total countywide ask across the board is over 20 million, leaving a deficit or a difference or a delta of $10.3 million. All right, here we are at our homepage. This burn application homepage. So to walk everybody through this, sorry for the repeat, but I want to make sure that we're resetting every time. The entity on the left are the applicants. If they are highlighted in orange, that means they are an existing current grantee and are part of the burn in that community. You've got then the reviewer score. There were 2 reviewers on a scale of 0 to 30, and that is the average of the 2. Across the next 6 columns are the 6 service areas that are able to be funded and included in the application. Screening, assessment, substance use disorder services or treatment, peer supports, and housing. Last but not least, harm reduction. So anything in blue, there's a light blue there. You can see that one of the 2 reviewers recommended funding that service area for that entity. If it is green, that means both of the reviewers recommended funding that service area for that entity. And when there are orange cells, and for this particular county there are not, that is neither. So neither of the 2 reviewers recommended that service area for funding. And the next column over are program costs, and you can see that those numbers vary pretty wildly. Just to kind of orient you quickly to, for example, Life's Intention, you see that the program costs are almost $3 million, and you can see that there are no funding requests along the service areas in the row to the right of the name of Life's Intention. But that what we can infer, and the reviewers will confirm, that in their budget workbook, they simply took all of the funds they would be using in these service areas that they're applying for and put them in program costs. So there were different ways that applicants chose to use the workbook, and so we'll make sure to make as much as possible as the application allows, make that clear. The total on the right-hand side here, just before the priority Y column, is just the total of all of the service areas and the program costs, the total for each application. And then the priority score was simply a way we wanted to help illustrate how thoroughly each applicant completed 3 grant questions. One is the question around cultural and linguistic services and competence. The second question is providing services that are serving underserved or some may say marginalized or underserved communities, and that is including everything from trauma-informed care to intellectual and developmental disabilities, gender-affirming care, and the like. And then the last question is around ensuring that they can bill for Medicaid, and if they do, that they don't supplant, so that the DTRSF funds are absolutely reserved for folks who are uninsured or services that are not covered by Medicaid. Whew. All right, so that's our home base. We're going to go ahead and dive into the reviews. And the first 2 reviewers for Boulder Care are Kirsten, who I know is not here today, and Rachel. I know you're not feeling well. However, you can chime in. We just absolutely appreciate it.
Sure. So for number 7, their answer is Boulder Care is committed to providing intersectional, culturally, and linguistically specific services to patients. Boulder maintains an active organization-wide diversity, equity, and inclusion program that engages staff in ongoing discussion and educational topics using both internal and outside expertise. Boulder is focused on a variety of issues affecting its diverse patient population. For example, anti-racism, the intersection of race and the war on drugs, language education for specific populations, example, Native American, criminal justice and how it mishandles addiction, harm reduction principles. Boulder prioritizes a diverse care team, including clinicians and care advocates who will provide care themselves and help educate the larger care team staff based on their own lived experience and unique perspectives. Currently, the Boulder team is comprised of the following. 33% of the clinicians and clinical support staff identify as non-white, Black, Indigenous, Hispanic, Latinx, Asian, or two or more races. 80% of clinicians and clinical support staff identify as female, 20% as male. 3.6% of clinicians and clinical support staff identify as LGBTQIA+ or Two-Spirit. The answer to number 2 is they are, yes, they are both billable to Medicaid and they do bill Medicaid. Their peer support is, I believe, I have to look at this. I believe it's just offered through their telehealth based program. They are not asking for housing support, and their harm reduction offerings are the distribution of Narcan and fentanyl testing strips through the Burn network.
Before we moved to CCS, and Ariana's on deck for that. Okay, thank you, Rachel. Ariana, and others who can help jump in.
All right, CCS. Their answer to question 7, and they did not number their things. So this is kind of all together. CCS is dedicated to incorporating a cultural competence framework into its behavioral health services to ensure that care is effective, understandable, and respectful of the diverse cultural, ethnic, and linguistic backgrounds of those served. This commitment includes assessing and addressing religious beliefs, ability, and other axes of identity to provide individualized services that honor and align with each person's beliefs and needs. CCS has also implemented a series of strategies to recruit, retain, and promote a diverse staff and leadership that reflects the demographic characteristics of the areas we serve. To support these efforts, CCS conducts regular organizational self-assessments of culturally and linguistically appropriate services, activities, and integrate cultural and linguistic competence measures into adults' performance improvement programs and patient satisfaction evaluations. We collect and integrate data on patients' race, ethnicity, and language into its management information systems and maintain a current demographic and epidemiological profile of the community. Additionally, CCS will ensure that conflict and grievance resolution processes are culturally and linguistically sensitive and regularly update the public on progress and innovations. I'll just say in reviewing this, I found this to be very general. For SUD, they do offer Medicaid eligible services. They're asking for money for personnel expansion and adding positions to their staff. So their approach is to bill first and use Measure 110 dollars to back that up. For the peers, they run a stabilization center, and so that is more in-house. And there's also a warm line. They don't really do a lot of outreach, I don't believe. And actually,
So, and thank you, June, for flagging there, the CMHP. So question, Ariana, for peers at $5 million. Are those folks integrated into their SUD treatment, into the housing program? What is that looking like?
I did note that the costs seemed high for the services that they were planning on using. They're including their EHR in the ask under peer support, and a lot of salary money. They also have this odd thing, peer support client stipend. The peer support stipend allows peers to purchase essential items that clients may need, such as food, clothing, or other basic necessities. This financial support helps peers address immediate needs, reducing stress and barriers to recovery and fostering a stronger support network. So basically what their peers are in the position of buying things for their clients, which is an unusual approach. As far as housing, it's rental assistance. There are emergency placement vouchers, which are for temporary housing. And that's really it. And then harm reduction. Kind of big. There's $300 for medical supplies and $1,000 for pharmacy, which looks like it's medication for opioid use disorder. And so they don't list anything like syringes or naloxone.
Thanks, Ariana.
Mm.
Questions about this application or comments from the panelists? Okay. Megan.
Hi there. Ariana, when you say syringes, is CCS doing syringe exchange? Is that the nature of what they're talking about for harm reduction?
No, I actually didn't recommend them for harm reduction because, and my note is leans heavily on naloxone distribution, but doesn't speak to other modes of harm reduction. And so somewhere in their narrative, it talks about naloxone distribution, but nothing else.
Okay, that's understandable. Thank you.
Mm-hmm.
Any other questions? If we get down to it, I'll have some more curiosity about the peer support, and I'll also note as folks are thinking about how we get to a formula recommendation for the OAC. This application, I think, is pretty much taps out the entire formula for that community. So thinking about how we want to listen hard to all of these reviews and then make some recommendations. June, hi.
Yeah, I don't want to hang this up, but I just want to make sure that I got this straight with their almost $5 million ask. their peer support are not going to be community-based services.
That is what I understand. Although I would clarify, community-based, they are in the community. They're just in one place. They're not actually going out into the community. There's no mention of mobile service.
They're not in the field, they're in the office.
Thank you.
Yeah.
Yep, which can be expensive. Kathy, go ahead.
In their project scope, it uses those peer staff in their housing. That's what I read. Measure 110 funding would bolster CCS's housing program by hiring 3 housing peers. And that's listed underneath their peer support and mentoring. So it does blend with that housing.
Thank you.
Tim?
Does it, I'm not an expert, but it just kind of strikes me as odd that they're not in the community at all, given the very large area, the sort of rural nature of my understanding of Umatilla County. It seems kind of strange that they would just be at one location. I imagine that would limit the amount of people they could access pretty severely, right? Limit their ability to serve the whole county.
I don't think it's not clear in their application.
I would like to speak to what Tim said as well, just coming from a former service provider of Umatilla County, and being a peer mentor and also running peer programs. Umatilla County is large geographically, and so there's quite the service area to cover for folks in the county. And so I would also be, curious if the peers are out doing outreach and traveling from town to town, just because of, it's a huge county. Hermiston, Pendleton, Milton, Freewater, all the way over to Morrow. And so, and there's no public transportation either from Hermiston to Pendleton. So yeah, thanks.
June?
Yeah, I echo everything that Tim and Megan just said, and there was something else that was very confusing, is that they want to hire peers to provide housing, but they don't have their own housing. They plan to, and my understanding, what I just heard is that they just plan to provide vouchers. So that was kind of odd.
To clarify, it says CCS has established a comprehensive housing program in Umatilla County, offering supportive housing, housing vouchers, and rental utility and other financial assistance. But it doesn't, although it says that they offer supportive housing, it doesn't necessarily say that they own it or what it looks like.
Thanks for the clarification.
Tim?
Okay, well, I'm just looking at their application, and with under the peer support, question 2, related into scope of work, they do say engage peers engaging in community-based activities, including proactive outreach. So I wonder, I know Ariana, you said it's unclear. I agree it's unclear. I would allow for the possibility that maybe they don't just operate out of, maybe they do sort of outreach outside of that singular location. I would certainly hope so. And in their housing, where it says their housing, it says, and this is where they're supposed to describe the scope of their housing activities. It says M110 funding would bolster their housing program by hiring 3 peers dedicated to Umatilla County. These would focus on assisting clients with overcoming housing related barriers, including securing rental assistance, navigating housing applications, conducting background checks, transportation, et cetera, et cetera. It sounds like it's more like resource navigation than housing per se, which is allowable, but different, right? Than like we are going to house folks.
Yeah, and their focus really is on a stabilization center. And my impression is that that is not, they may be spearheading it, but it's a collaborative space, which is not a bad thing at all. But there's also a navigation center where individuals can come to access services and information related to housing, treatment, education, and supported employment. So it's not, that building is not being used for housing. It's being used as a stepping stone to get to other places that offer housing or to get assistance.
Any other comments or questions before we move to EOCIL? Okay, thank you for the conversation. So both Michelle and Sarah are not here. Sarah Adelhart are not here today. So Ariana, Jason, Kathy, can you please assist with answering the questions? We know for sure that they're not the CMHP. Could someone please read question 7 or answer to question 7?
I have got question 7. It says, yes, to enhance prevention, harm reduction, and housing outcomes, all services are culturally and linguistically tailored and offer disability accommodations in alternative formats. EOCL tailors prevention and service approaches to meet the diverse needs of key communities, men who have sex with men, transgender, sex worker, people who are institutionalized, incarcerated, and other closed settings, people who inject drugs, migrants, minority, ethnic communities, BIPOC, people living with disabilities. We participate in Escalate TA. It's a stigma reduction, and ARTIC, which is an anti-race trauma-informed care work groups, and sit on the Oregon Department of Justice Hate Crime Bias Work Group. Our services are accessible through mobile outreach, telehealth, anonymous harm reduction text line, language line, in-person interpretation, TTY, and multiple engagement approaches. We have staff that are both bilingual and bicultural.
Kathy, moving over to their housing and harm reduction, can you share if that housing is, what kind of housing is it? Rental assistance, shelter, transitional, supportive housing?
Their housing is, they start off with the statistics that they were 397 people counted as homeless during the point in time count. It does not, it looks like permanent and supportive housing. And that's about all they say on that.
Thank you. And harm reduction, what's their menu?
They focus on a comprehensive, multifaceted approach, and the services we provide were specifically called out as being needed as a best practice intervention. Harm reduction, both at drop-in and during mobile outreach, will provide the following, but not limited to: HIV prevention kits, pre-exposure prophylaxis, pre-EP, rural clinic education and prevention kits, needle and syringe exchange, overdose prevention, drop-in and outreach activities, and HIV, HCV, STI screening, testing, and linkage to services.
Thanks, Kathy. June, please go ahead.
Yeah, I just wondered if in their application anywhere or application materials that they say where their housing is located in Umatilla County. I was just wondering.
I do not see that in their description of their housing. They just say our housing navigate services that were deemed needed through the Oregon Housing and Community Services recommendations and validated by the Oregon Housing Alliance Community Need Sheets, National Low Income Housing Coalition, County and State Fact Sheets, and Permanent Supported Housing Needs. So, but it does talk about a housing navigation center that will offer a place to gain the supports needed to seek, identify, obtain, and maintain housing.
And we're on EOCIL, right?
Yes.
Yes.
Yeah, so in the project scope, it does say their cultivate supportive emergency housing agency owned is in Pendleton. It's a fourplex with 1-bedroom units. They have their cultivate supportive emergency housing, emergency vouchers in Umatilla, and Hoto vouchers. So they have at least one house in Pendleton that they do list.
Great. Thanks for the answers and questions. Anything else on EOCIL? June?
Yeah. Sorry I'm being so critical and asking so many questions. I live in Umatilla County, so I just want to know, I guess, clarification on their budget for housing. What exactly are they spending that money on then?
In their narrative, they put 0.5 FTE chief executive officer to ensure grant compliance and contract management, 0.25 FTE housing coordinator to provide assistance and housing program compliance, 0.33 FTE housing maintenance to agency owned burn funded property, 1 FTE housing navigator to provide housing navigation, 1 FTE behavioral health specialist to provide screening, assessment, and ongoing therapeutic support. It goes on to state that under the program staff training costs, housing navigators are certified recovery mentors and community health workers, and our behavioral health specialists are certified drug alcohol counselors.
Go ahead, June.
So there's nothing else in the budget but staff? No.
Well, that's what they're staffing. What I listed off, that was in their housing narrative on the proposed budget. So that was all of the ones I just listed. And that comes out to all of their listed under their housing. That is 1.2 million that they're asking on the staffing. And then under their program staff training cost, we're looking at about 6,000 across, and this is across the 4 years.
And they do have services and supply costs of 240,000.
Yes.
Okay, great. And just for clarification, they're wanting to hire a staff person to do screening and assessment under housing?
I didn't see where it said screening. Their housing navigator, housing maintenance, housing coordinator, and a behavioral. Oh, okay. It's under the 1 FTE behavioral health specialist to provide screening, assessment, and ongoing therapeutic support. Since they did not, doesn't look like they applied for screening.
Thank you.
Mm-hmm.
Anybody else? All right, I put in the chat next up, Life's Intention, Mark and Sean.
See here, number 7, we're open to serve all people regardless of race, beliefs, and gender, or any other areas. Youth need to feel respected and heard without judgment or stigmas over their heads. Understanding the variability within and across racial, ethnic sub. For Medicaid billable, currently they're going to be going through the credentialing, and they've established an NPI number, but until they have set that up, they'd be using the Measure 110 funds. let's see here. So everything's kind of lumped into the program costs. When it comes to peers and everything, they have over the course of 4 years about a little under 2.4 million when it comes to staff, including a program director, CADC2, full-time times 2, so 2 CADC2s, CADC1, CADCR times 2, 6 peer staffs, part-time peer, administrative staff, dietary and LPC. And then, let's see here, about 493,000 rolled into services and supply costs, including lease for a building, vehicle, and furnishings. Those are the top spending on those, and then the rest is under training costs for the staff. Let's see. When it comes to harm reduction, sorry, 1 second here. Gotta scroll up to it. Their peers, they will go out into the field to help children get to a safe place and help them go to and from appointments. When it comes to harm reduction, they state that they will work with the youth and substance use related infectious disease screening, sobering support, contingency management, information and education about harm reduction services, referral for hepatitis, HIV, STI, COVID-19, and tuberculosis testing, vaccine or other healthcare services, peer-delivered support, mentoring and recovery services that address parenting and youth and transition support, pregnant counseling on bloodborne pathogen transmission, effects of alcohol, tobacco, and other drugs on the fetus, and a referral to prenatal care, counseling and education as well. And they don't cover housing, at least not yet.
Thank you, Sean. Questions? Comments? Okay. Last but not least, in Umatilla, we've got Oregon Washington Health Network. I believe Maya is not here, but Stanley is here.
Yes, I'm here. Number 7. Oregon Washington Health Network is a unique in the community. It offering Spanish-speaking services and peer support. These services are based on CLAS standards. Proposed services are primarily designed for a delivered in Spanish-speaking communities with a particular focus on migrant workers, including H-2A workers and individuals regardless of immigration status. A key focus of the Plan Center is to offer cultural and linguistically appropriate services, ensuring that these individuals feel safe to seek help without fear. The proposed center will provide a welcoming environment for peer support, educational workshops, and community events tailored to Spanish-speaking families committed to meet the needs. It will offer bilingual services in both English and Spanish, ensuring culturally sensitive support, with resources such as computers, arts and crafts, a recovery resource table, and a library. A center will serve as a hub for personal growth and recovery, designed to be family-friendly. Parents are encouraged to bring their children while remaining responsible for their supervision, and supplemental childcare is offered as part of the program. Barrier access to treatment services. I was just reading about they can bill Medicaid, Medicare, and other insurances, and they were working on a sliding scale. Their peer, they're established a robust support network connecting individuals with trained peers who have lived experience to foster trust and to empower participants to navigate their recovery journey, making sure more accessible and relatable, offering Spanish speaking services, which I said in the other one. Housing, stable housing is a critical foundation for health and recovery. They plan to allocate funding towards providing housing support services, including transitional housing, and assisting in securing permanent residence. And the next one is harm reduction services, a mobile unit, and wound care and Narcan purchase. They talked about a gap in the community is mobile wound care. And so they want some of the funding to utilize to staff nurses for outreach.
Thank you, Stanley. Anything else?
That's all I have. I don't know if anybody has any questions.
Yeah, that's next. Comments or questions, June?
Yeah. What exactly can somebody open up their budget and what exactly are they going to be using the funding for SUD, peer, and harm reduction? Like where is that money going? And I also wasn't clear. Do they have their own housing? Because 48,000 for 4 years, if they have, it seems really low. So I just like to get an idea of where the money is actually going.
I don't have their budget up, but I will look at your housing question. I know it from reading it, they do have other houses and other locations.
I'd be happy to read the narrative from the SUD treatment. The staffing plan illustrates a comprehensive team to deliver substance use disorder treatment, support, and culturally competent care. The program director manages operations. The administrative assistant supports daily coordination, and the peer recovery specialist provides lived experience support. The nurse, which is a 0.5 FTE, addresses integrated health needs, and the BHC provider offers specialized counseling. Note the 40% fringe benefit listed for each personnel. Together, this team ensures effective, client-centered care and operational efficiency, aligning with the program's goal. And I also need to note that the screening and assessment, they did not put any funds down for that, but they had requested those services, and they are wrapped up in your SUD and your peer support.
Go ahead, June.
So are both of both the SUD and peer support, is all that funding just going to FTE?
No, there's some public transportation vouchers under SUD, along with staff mobile unit, which is $20,000 a year. They have some supplemental childcare services, and they have case management supports.
Any other questions? Okay. I'm going to move on to some numbers to work with. So as we already know, this county is about double their formula. And these, again, this summary is just the ones that had 2 yeses, 2 recommendations. Here we are with some of Ariana's mathing. Potential burn number 1 is looking at just previously funded burns, which were previously funded partners, which is still over $3 million. difference, and I'll call on you in 1 second, June. One of the things, that came up, oh, come on, I hate it when I can't go back. That came up yesterday when we talked about, I think it was Lincoln County, is each county has a base in their formula, small, medium, large, and extra large. And that would be something also put on the table, is looking at the total amounts and just simply giving organizations maximums that they could start to build their budgets with. So that is for your consideration. We'll June and go.
Yeah, and I don't want to be too breathy. I live in this community. I've been in this community for a lot of years. I've provided supports to people. I've gotten supports for substance use disorder. I just really want to advocate for Boulder Care's SUD program. This county is rural. There's a lot of people that do not have insurance, that do not have access to MAT treatment in this community. And also would like to say that peer services are best done in the community, boots on the ground. And so with that, I really think that community counseling solutions asked for peer support is outrageous.
Morgan, thank you, June.
I like the option number 2 to diversify, include Boulder Care, like June just said, but sorry, I'm coming into this a little late, Abby. Like what you said, just giving the orgs a maximum and letting them build their budget out. But yeah, that peer support ask for community counseling solutions for Umatilla County's population is so insane. That's so wild. So yeah, proportional on their ask there would not be equitable here. So I do like the service caps. And I think that number 2 as is probably would work. What is community counseling solutions funded at currently? Is that in here?
No, that's not in here. This is just what the applications moving forward are. But if one of the reviewers has the application up, we can pull up the past recipient tab on their workbook and get a sense of their current.
Yeah, because still $4 million for that one org in this rural county is a lot. So I would maybe, depending on their current funding, maybe drop that even further and just let them build their own budget out with the 3 million or 2.5 million or whatever it is.
What is the cap? I'm sorry.
Here, sorry. Let me do this. So the countywide formula, 1 sec, June, is just under 10 million, Ron. And then that base we started talking about yesterday, I know this is so tiny.
Right, that's why I wanted to walk through this and see.
Yeah, it's 3 million is the base here. Umatilla is about halfway through. And if folks want, I can share a beautiful little spreadsheet that Kathy mocked up this morning using that base as a guideline for all of the applicants. And if you want me to do that, I'm happy to do so. But I've got 3 in the queue, starting with Keisha. We can't hear
me
you
better.
There you go. Better.
Yeah, I just want to make sure that the previous funded organizations get more than being at the same level as some newly entering entities, just because they're already built up and established. We don't want to really take too much from them. Like with some counties, there was enough money to spread around, but with this county, it's a little different. So I think, yeah, I don't know what a suggestion would be, but making sure that the existing providers are getting enough money to do what they need to do.
Okay. And while you all are talking, actually, let's have everybody kind of go through, and then I'll offer a screen share before Ariana does some public math. So starting with Megan.
Hi, Abby, thanks. Just looking at burn number 2, I definitely want to echo what Morgan pointed out, that this would definitely create more space for equity. With that being said, the data shows that delivering harm reduction services is most effective when we have folks like peer mentors or folks with lived or living experiences, lived experience doing that. Oregon Washington Health Network has a pretty robust peer program. They currently do Prime Plus in Umatilla County. And, you know, to my knowledge, I think they do that pretty effectively. They do actually provide like low barrier services. They also have Nurture Oregon, and Greg Bledsoe's on here. He's actually the contract administrator for that program. And that really is a program that seeks to provide low barrier care to pregnant people who are using. And they do that, you know, through a harm reduction lens, to my knowledge. And so I just kind of want to point that out when we're thinking about making these funding decisions. Thanks.
Ariana?
I think Morgan's hand was up first. No? Okay. I wanted to point out that if we apply this 3 million cap, it only affects the 2 previously funded partners, and it puts us at 2.8 million over.
And I can share that. I'll do that, Morgan, while you're talking. Go ahead.
Oh, I just wanted to reiterate support for the Oregon Washington Health Network. It's scored well with integrated service proposals, and there's just a really high need for those particular services in that county. So depending on what Abby's about to say here with the previously funded grantees, just, you know, to see if we can continue their services around where they were previously funded, without looking at any expansions, removing capital outlay. I just don't want to see, you know, any dramatic reduction in services, but I do want to see these other organizations coming online to meet some of the wider needs in that community. And myself, having done some work out there even recently, it's a very, 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 very high need community.
Kathy, go ahead. Thank you, Morgan.
Community Counseling Solutions previously only had supported employment. They did not offer any other services during this last grant period.
That makes sense. I'm going to Kathy, thank you for throwing this spreadsheet together. I'm going to share my whole screen. So I'm sorry if it's a little wild, but I just wanted to be able to have both windows up and be able to show you. Kathy, thank you for this. So I just wanted to show what we put to, so this was kind of on the heels of our conversation yesterday, and I know it's kind of small, but this is Umatilla County. Here are all of the providers, and looking at just off, you know, capping all like the not to exceed number, like the total grant at 3 million. Does get closer to the formula amount. It's still 3 million over. And then, you know, the OAC has been pondering, you know, how do we give everybody a bite of the apple, but reduce it equitably? I don't know if there is the most equitable way of painful decisions, right, is, and actually Morgan made that motion, 70, 80, 70 something, a reduction of the ask. And so this is just some mathing that Kathy did before 8 a.m. this morning, feeling a lot of appreciation for this. So this is an additional layer that y'all might want to add into the thinking. And now I'm going to go back to this screen, which is everything we're talking about today. Morgan, please go ahead.
So, you know, with the 75% of the ask there, I would be comfortable with that capping. I am a little concerned about Community Counseling Solutions proposed budget. They were only funded for supporting employment last time, and their ask right now is $10 million, knowing that the funding formula for the county was also 10 million, or I don't know what the timeline with the funding formula. They had to at least suspect.
It's based on the current grant cycle that is already in place. That is the only services that they're under, is supported employment.
Right. So just
okay.
So right. So an organization that was previously only funded for supported employment put in a grant application to take 100% of the county's funds. I just want to make sure I'm understanding this correctly.
It's likely they didn't know the allocation when
Okay, fair. Totally fair point. Still, $10 million for an organization in Umatilla County is super duper crazy of an ask. So I just, I just want to make sure that that $3 million cap there is equitable and that's not sort of disproportionately giving a bunch of money to community counseling solutions, because we're not talking about continuing previously funded services because they were not previously funded to do those other areas. So talking about a reduction for community counseling solutions is not talking about reducing already funded services. So especially since we're still over even on that, with the cap, I would be comfortable probably chopping another $1 million off of community counseling solutions, and trying to spread that around the other orgs. So like capping them at 2 million, seeing what the rest is, and then maybe proportional reduction beyond that.
Okay, I am about to, I don't want to prematurely stop sharing this screen, but I know we're going to jump over to Ariana's math in a minute. I want to get Liz, June, and Keisha in the space first in case you have questions you want to be looking at this. Liz, go ahead.
Just something, I don't know, that kind of comes to mind. I'm a little leery about capping just for the sake of bringing dollars down, because some folks are providing services that in more service areas than others, and then some are also providing service areas that might be more expensive than others. So like housing, you know, it takes a lot more money, I think, to keep people housed than maybe just doing like, you know, a mobile harm reduction program. Because we know that housing is so expensive and there's just not enough of it. So I think we have to kind of put some thought into, you know, if they are asking for a lot of money, what kind of services are they, you know, aiming to do with that money?
Great. Thanks, Liz. June, go ahead.
Yeah, thank you. And I echo all that Morgan said. Morgan missed it when CCS was presented, and many of their services are done in office, not in community, like out pounding pavement, which is troubling, especially for peer support. And so also to kind of get down, I think we could probably remove harm reduction from Boulder Care and CCS from potential burn number 2, free up some funds. And also, if we're going to be freeing up funds, I really would advocate to not fund CCS for peer support.
I might need you to repeat that, June. But first we're going to go to Keisha, then Morgan, then I'm going to hand the reins to Ariana. Go ahead, Keisha.
Yeah, I was just like, they might have asked for a whole lot of money. A whole lot of applicants asked for a whole lot of money. That's not the point. Because they are previously funded, they probably have an outlook on what's needed. And that's why the ask is what it is. With supportive employment, that includes peer support housing and all those things too. When you're trying to help somebody be stable. Anyway, I just don't want anybody's biases to like chop down what our priorities are and what we said.
Morgan?
Thank you for clarifying that about some of the service delivery methods there. Again, just having been to Umatilla County, the rurality is really stark and people don't commonly come over. I mean, God, people go like more often to Tri-Cities than some of the other Umatilla County cities just because there's such low service areas. So considering that and some transportation concerns, if their services are predominantly offered in a, you know, medium barrier fashion out of their own brick and mortar place and not meeting people where they're at, which is one of our stated goals when we're looking at funding people, is looking for organizations who are delivering the services out where people already are, instead of expecting them to come in a high rurality, low transportation county to the office. So yeah, again, I would probably just look at reducing community counseling solutions because they were previously funded in a very narrow way. And we have several very strong applications here for this county that we can fund various organizations that will meet various populations' needs and still maintain all of our values in ensuring that people are getting the services where they're at.
Sorry, just catching up on the chat. Thank you, Morgan. Ron, go ahead.
Yeah, I just want to just kind of chime in terms of being consistent, how, just to kind of speak to being consistent. Because in previous review panels, we held pretty solidly to the idea of not expanding services. And so I'm just trying to pose that as a question in terms of, is that a consideration, or is that our constraint? Because if it's a constraint, then it really limits what we can do for community counseling solutions because that is an expansion of services.
So my recollection, Ron, is that has really come up at OAC meetings, not so much in this space, and that was voted on Wednesday by the OAC. And we on the Measure 110 team are making sure that all of that is represented to the OAC in your upcoming votes. And I think my understanding is that in these review panels, these are all hard decisions, and really everything is on the table. And if folks want to look at a consistent way to reduce in the least, I almost said equitable, but it's not like the best terrible way of reducing, just knowing that there are limited funds and so much need. We've been looking at reducing, capping service areas to dollar amounts. We've been looking at reducing the whole ask by percentages and really just doing as much creative problem solving as possible just to get to a reasonable spot. So I think the consistency really is the incredible deliberation that we've all been doing with each application for each county 331 times together. So I think that if someone is looking at the application and noting what was provided and going, oh, actually, CCS last time was funded for this and they're asking a lot, we just can't manage this kind of ask in this community. We have to build a burn. And if it looks like there are other service areas that are covered by other partners, then there are absolutely creative ways to get to a recommendation.
Thank you for that. Appreciate it.
Sure, Tim.
And Liz kind of referred to this, that when we just do the cap reduce on all service areas, I think sometimes we end up missing the nuance of what's being offered. For example, what I'm thinking of is CCS, their housing they're not physically housing people, it's housing like resource navigation. And this would be paying $1 million for that and $1 million for EOCIL to actually be housing people. And I don't think that really makes sense. My recollection is EOCIL, they are housing folks and they also have housing resource navigation as well. So I almost think I'd much rather just give them the $2 million to do that work. And it's they're supposed to be a network. So I'd be fine if EOCIL is the partner in that organization that is housing people and helping people get access to housing. I would much prefer to just give them the money for that service rather than sort of spread it out too thinly in this case, I think is what that would be. So I would suggest not funding CCS for housing if we are on a money crunch. I think giving EOCIL close to their full ask or their full ask for that service area, because they are the ones, I think they're providing the most amount of service in those activities.
I'm going to stop screen share while Sean takes the mic, and I think it's time to do some honing in on a proposal. Go ahead, Sean.
You're talking, Sean, we can't hear you.
Oh, sorry about that. Thank you. I just wanted to voice my opinion and raise a concern when it came to like the burn 2 option where it capped everything at $1 million. Life's intention was kind of to their detriment on that one, that they rolled everything into the program cost. And I just wanted to point out that they their population that they're trying to help is the youth, which consists of about 24% of the county. And limiting that is kind of, in my opinion, an issue when it comes to one of the most sensitive populations that need help. So I just wanted to voice my opinion on that one.
Thank you, Sean. Keisha, and then Morgan.
Yeah, with just being with consistency, I mean, I think what is it? Community Counseling Solutions asked for like 10 million. Their cap is 3 million, but they are serving every service area. So I wouldn't want to take from that budget, whatever budget we give them, they're going to have to work out. Instead of looking at service area by service area, I mean, they are providing services in all the areas. So I think 10 million to 3 million is a huge cut, and let them decide whatever they want to do for consistency.
Thanks, Keisha. Go ahead, Morgan.
We previously in the OAC have talked about not always wanting to fund large service expansions. I think the point, because we have repeatedly said that we want to be funding organizations who are doing the provision of direct services. So if Community Counseling Solutions is doing housing resource navigation and trying to place people, but EOCIL is doing the direct service of housing people, I would much rather kick some of CCS's budget towards EOCIL so that we are getting the best, human return on investment possible, and housing folks. Because if CCS is not actually housing folks, but EOCIL is, and this is a this is a resource network with MOUs between them. Just because we take from one and give to the other doesn't mean that the community won't in the end still be getting the service. So I would like to see out of the proposal, Community Counseling Solutions budget capped at 2 million, and they can decide how to do it. If EOCIL is going to be doing the housing, and then proportional reductions all the way down. Just to stay
Right.
the values of funding direct service providers.
I'm sorry, I think I was maybe talking over you. Can you say more about proportional reductions all the way down?
Oh, so because there's still what, like a 20-ish, 18% overage or so, right? Or not?
Yeah, the cap is 9.9.
Yeah.
Right. Okay.
So 1.8 million over is where we're at with this.
1.8 million.
And just to let you know, this is because of the caps, this number here is the totals, which includes the caps. And so it doesn't actually do the math on these numbers in here.
I think there was a note, maybe we could take some of the harm reduction. No, no, touch that. So then let's see, maybe 18, no, because then you'd have to double it because of the budget. Dang. How does somebody else want to get to the other number? Or do a 18% from all the numbers we see on our screen, 18% on the ones that haven't already been capped, which would then need to be higher.
Let's give the mic to Keisha and then Liz and see what they got.
Yeah, I'm just a little concerned about lowering a previously funded organization for the cap when you're only looking at housing when they're serving all service areas. It's not just housing. So I'm a little I'm not for that idea.
Liz?
I'm wondering if maybe we can go back and look at Life's Intention a little bit more. If I remember right, that's a youth-specific organization, and their ask is quite large for only serving youth. And so I don't know if maybe it might be helpful to understand more of what they're doing and what those program costs look like.
All right, let me pull up the chat and see who those reviewers were. Mark and Sean.
I'm sorry, what was the question?
I think just the budget seems really large for serving youth. And so I'm wondering
Most of what I was gathering when it came to, or what I was seeing with their budget is, the just under 2.4 for the personnel costs. And each year it's about 597,000, but it's 1, 2, 3, 4, 5, 6, 12, about 14 to 15 staff members. Over all the different service categories that they're asking for, and then per year, about 100,000 for services and supply costs, including lease and furnishings and everything.
is this an organization that's like been around for a while? Like they're already up and running, or?
Maybe Mark can help me with that one. I know that they speak to their staff and having decades of experience, but not how long the organization's been open.
So of the
I'm
folks,
looking there.
oh,
Sorry,
thanks.
go ahead.
No, and I'm just trying to kind of agitate our conversation forward a little bit more. And thanks for that inquiry, Liz. And maybe that's a recommendation that folks would want to consider as well. I just want to look at folks who have said, reduce this, move the money over there. We'd like, really like those offerings, make sure that every service area is built, like something we would need to inquire as to this potential. With the $3 million cap that Ariana is showing us, we need to have a sense of how much is being invested in screenings and assessment. Since right now those dollar amounts are zero, knowing it's in the program cost, we'd have to just better understand what that is. Yeah, so kind of how is this looking? What are your thoughts? Definitely want to get Liz's question deliberated and see if there's a recommendation. Liz, whether you've got something concrete. Right now, Morgan has her hand up. Go ahead, please.
Oh, if Liz has something else, I was just gonna do some guesswork.
No, I think we've kind of spent quite a bit of time focused on CCS and EOCIL in terms of cuts, and I'm just kind of wondering if maybe we should also look a little closer at Life's Intention and Oregon Washington Health Network, because their asks are quite large as well.
Yeah, so let's see. Again, because Life's Intention is serving, while it is a priority population, it is only a quarter of the county, so it just maybe capping that at 2 million, and then for the rest of the overages, I think hitting them from the ones we haven't touched yet. So it would be like 15% off Boulder and Oregon Washington Health Network, maybe a little more than 15%, maybe like 18%.
You want 18% off of Oregon Washington Health Network?
Oh, I'm just trying to get down to the ask from there, so it's another almost $1 million actually, dang. Or wait, no, 6.
Somebody wrote in the chat that Life Intentions was just formed in 2024.
Oh, they're new.
Okay, so that, I mean, that's pretty important, I feel like, for an org that's asking for quite a chunk of change.
I could suggest that taking Oregon Washington Health Network down to 2 million would actually get us very, very close to formula.
I would really like to try to leave them as close to their ask as possible.
Keisha?
Yeah, I still don't feel comfortable taking the previous organizations under the cap. I mean, it's only two previously funded organizations. Keeping that at cap and then spreading the rest around.
So then this would go back up to 3 million.
Yeah, and they're providing a lot of services to cut like 90% of their ask. And for consistency.
Morgan, a new hand? Yeah.
Yeah. Well, for consistency, we said we weren't going to fund service expansion, which is the vast majority of what Community Counseling Solution is asking for. They're only previously funded for supported employment in a very narrow way. So I would prefer to again put them at the $2 million cap, and with Life's Intention being such a new organization, I'm even a little bit uncomfortable at funding them for $500,000 per year. Maybe cutting another 250,000 off of that, and then we're taking the rest from Boulder Care and Oregon Washington Health Network would be how I would do it.
You should go ahead, please.
I'm sorry. I'm still uncomfortable, but I want to say we need to really be careful with our words because this is a live stream and we are really we're supposed to be focusing on the application in front of us. So I will be really careful with our words.
That's fair. Thank you, Keisha. Ron, go ahead and we'll see if we can get to something reasonable here. I mean, it's not none of it's reasonable. It's all hard, but go ahead, Ron. Get us a solution, would you?
Well, I wish I could. I was really just focused on the fact that the only screening and assessment was going to be done by, I guess Life Intentions has it in their program budget. Community Counseling Solutions has it in, it was only supported by one of the two reviewers, but it's just, for me, those are missing service elements in the burn. And I just wanted to call that out.
Greg.
Did you just call me Abby? Sorry, I didn't.
Yeah.
Oh, I just wanted to clarify. Is CCS the CMHP there?
Yes.
So they already get a lot of money to provide those services. Is that correct?
I know that they're the CMHP.
Okay. So they're funded to provide a lot of those services. I'll state that instead of ask the question. Thank you.
Go ahead, Morgan.
So Keisha, does that influence your decision? Because in many previous meetings, I've heard you not want to fund orgs that were the CMHP because they already do get so much money.
Definitely. And we took the ask down tremendously. Like, I'm not sure.
But this is still funding them at like a triple service expansion from what we previously did, and they're already the CMHP. So would you be comfortable capping them at $2 million here for Measure 110 funds, knowing they're the CMHP, so that we can give that other funds to these other organizations that are also meeting really important service needs?
Yes.
Okay, so back to 2 million?
Yes. And then from here, however OHA wants to get down to the rest, I am very content.
Thanks. So we're looking at 10.8, which is just under $1 million over, right? Because it's 9.9, right? Yeah, my glasses.
Yeah, that's correct.
Okay. Any other recommendations? Okay. Well, take a quick look at this. Let me know if anybody has a motion or any other recommendations or suggestions, please.
I have a suggestion, and that is that we cap program costs for Oregon Washington Health Network at 1.25 million. Because they are pretty up there.
Any heartache with that? Any concerns about that?
We're
I'm just wondering because everything is wrapped into there. It's kind of hard.
It is true.
Yeah, I'm so nervous about that just because we're comparing apples to oranges here. Like, I mean, like, look at Life's Intention. Everything is in the program cost. So, like, there clearly was not very clear guidance on what goes where here because we've seen such a wide variety in the applications. If we could just say, let's, reduce 300,000 from them and 200,000.
And we probably do need to cap them at 2 million though, because they're over 2 million.
And
they're at 2.9.
They did not get capped at the 3 million level by me because they were technically right under it. But if we bring them down to 2 million, then we are.
No, I would much rather. Can we take them to like 2.5?
Yes.
Megan, thank you for your page. Megan's got her hand up. I want to make sure she gets in the queue. Go ahead and keep raising your hand.
I also would just want to express concern about dropping the program cost for Oregon Washington Health Network. Just to echo what everybody mentioned, CCS is the CMHP for Umatilla County. I think that it's important that, Umatilla County community members get choice and care. And so if we drop program costs from other organizations other than the CMHP, we're not creating more access. And so just calling that out. Thanks.
Thanks, Megan. Keisha, go ahead, please.
I'll go with the crowd, but probably to get us closer, I would still cap them at 2 million. Just because previous organization, just period, because they are new, I would cap them at 2 million for and get us closer to our number. They're still getting a nice portion of their ask, but 2 million I would cap them at.
Morgan?
They're not new to the county though. They're not new to providing services.
That's not in here though. That's not information. We can't bring all the outside information here.
I think we know when they were started and whether or not what services they've been
Yeah,
providing.
if they put that in the project scope, that would, if they have the history in that first section, but I don't have it up to articulate what's in there specifically. So
maybe let's take 200,000. So we're very, very close to the ask. So I don't think we need to take another 30% off of just one org's budget here. Because if we take, let's say, I don't know, 200,000 from Boulder, sorry, Boulder, then we're so super duper close. Could we just pass it as is, or could we then cut 5% from everybody's budget to get to the thing?
May I suggest voting on it here? Because I think that it's possible that 444,000 could be solved through negotiation.
Okay. Then I would like to make a motion to approve the Umatilla Burn Network as is funded on the screen here, this bottom portion.
This highlighted section here for clarity.
okay, motion moves. Is there a second?
Second.
Thank you, Ron. Discussion. Ron, is that for discussion or is that your second hand?
Second hand.
Okay. Keisha, go ahead.
Yeah, I was wondering because you said we were closer to the formula. Was that capping Oregon Washington at 2 million or as it is?
That is as it is. If you bring it down to 2 million, you actually have a slight overage. I'll show you. Of 55,000. So that's unallocated under the cap for the county. Does that make sense?
Yeah. So if we went with like 2.4 million, then we would be at the cap.
Pretty close.
No, yeah, probably 2.1 would be pretty close to right on there. And so okay, so that was more discussion.
Yeah, I'm wondering if Morgan can amend it to 2.1 million for Oregon, Washington, and we'd be where we need to be.
If they're comfortable working that out in negotiations, I would rather just keep everything as is, and then maybe they can work amongst each other to pick here and there from the budget rather than, dropping them when, because they had a very reasonable ask to perform the services, and I just don't want to penalize them for asking for like literally what they need instead of shooting their shot. So I would rather, because we're so close right now with what it was on the screen previously before the
But
change.
you penalize other folks for shooting their shot. That's
Not
crazy.
penalizing them for shooting their shot. They're still getting more by a lot. Look at that. EOCIL's getting 3 million. Community Accounting Solutions getting 2 million, and they're only previously funded for supported employment. But I mean, instead, I just don't think we just need to get so detailed. If Ariana said we can vote on it as is, why not just vote on it as is? And then work it out in negotiations. And we can make a note here and to look at, and they can't come to an agreement, look at Oregon Washington Health Network. Can I amend it to say that?
Right. I just want it to be good to go and not put all that strenuous more work on after this when it can just be good to go.
So sounds like Morgan's motion stands and that she would like to add, if needed, consider reducing Oregon Washington Health Network from 2.5 million award to 2.1. So Ariana, we need to make sure that that cell J41 is back to 2.5 million. And Ron is still seconded. We've had lots of discussion. Any other discussion? And let's just make sure to capture the motion with the updated, if reductions are needed, please consider Oregon Washington Health Network.
Could you repeat that last part again? Add
If further reduction is needed, first consider Oregon Washington Health Network.
Okay.
Thank you. And then Nikki will capture that for our decisions log. Any other discussion before we vote? Hearing none. Carly?
Did Dharma pop in? I don't think so. Keisha.
Yes.
Morgan?
Yes.
Ron?
Yes.
Abby?
Sorry, yes.
Ariana?
Yes.
Ane?
Yes.
Dana?
Yes.
Daniel? Danielle?
Yes.
Drew? Emily? Gregory?
Yes.
Greta?
Yes.
Hannah?
Yes.
Juliana?
Yes.
June?
Yes.
Kathy? You're on mute, Kathy, if you're talking.
Yes.
Liz,
No.
Mark,
Yes.
Maya,
Yes.
Megan,
Yes.
Nicole Egler,
Yes.
Rachel,
Yes.
Sean,
Yes.
Stanley,
Yes.
Tammy,
Yes.
Tatiana. I think she may have left early. Tim,
Yes.
and that passes with 23.
That's amazing. Thank you, everybody. I want to, Ariana, can you surrender the screen? And thank you so much for doing this. Really appreciate it. With 20 minutes left, I'm not sure how far we can get into Marion. She's a big one. Do folks have an opinion whether we move forward or take a pause until we meet again tomorrow?
We could just do demographic.
Maybe the intro.
The intro? Sure thing. Okay. Happy to do that. I just want to take a minute and share something that I think is pretty amazing that we have accomplished. Look how close we are. Everything in green has been recommended already. So yay, that's 29 counties. Yes. So just way to go, team. All right.
That's awesome.
It's
Great job.
better than it's great. So we've really created a lot of momentum, and thank you for that. So we will do the introduction. If Abby can find the right slide deck, there it is. We're going to go into the demographics, and so folks know who the applicants are to prepare us for tomorrow, where I know more of our colleagues will be able to join us. Here we go. All right, Marion County. All right, our call for conflicts include the applicants on the right-hand side. They are Allied Health Services Tigard, or CRC Health Oregon, Boulder Care Provider Group, Bridgeway Recovery Service, Church at the Park, Community Services Consortium, Confederated Tribes of Grand Ronde, Community of Oregon, HIV Alliance, Ideal Option, Iron Tribe Network, Marion County Health and Human Services, Mid-Willamette Valley Community Action Agency, Painted Horse Recovery, Pathfinders, Soaring Heights Recovery Homes, the Fourth Dimension Recovery Center, WVP Health Authority, doing business as Mid-Valley IPA, and Youth Era. For the folks present today, is there a potential or actual conflict of interest for any of these providers in Marion County? And when we reconvene tomorrow, I'll need to repeat the conflict check. Sorry, call for conflicts. That's the better way to say that. All right, moving on. Here we are, Marion County. Located in the heart of the Willamette Valley, and it's home to a diverse population. The county seat is Salem, the capital, which we all know, major political and economic hub. Marion County is a varied demographic makeup. 61% identify as white, 29% identify Hispanic, Latino, or Latina, 2% Asian, 1% Black, and 6% other. Mix of urban and rural areas, with Salem being the largest urban center. Areas like Silverton, Kaiser, and Staten are offering smaller, more suburban environments. The region is known for agricultural production, crops, berries, grass seed, wine, grapes, and contributing to the local economy and Oregon's broader agricultural identity. Here are all of the applicants that were submitted, all 17 past minimum screening requirements needed. The total countywide formula is $28.7 million, and hold on to your hats. The countywide ask is $75 million, which is both amazing and beautiful. And yes, these DTRSF funds do amazing things, and it's simply not enough. And yet, we're $47 million over. So thank you in advance for your critical thinking as we lean into this. I'm just going to do a quick review of all of the applicants, and then we'll close for the day. Okay, and the slides went out, so anybody who wants to take a quicker, longer, slower look in preparation for tomorrow, please do so. The applicants in orange are previous grantees. Ariana, go ahead, your hand's up.
Yes, may I just interject that one thing that I started to do with this round of slides is to put new service areas in red type here. So that is what that signifies.
Okay, all right, we'll need to make sure that we are being thoughtful about the consistency, but thank you for that. So what I ask of you is to look at the grand totals on the right-hand side. They vary pretty wildly. This is page 1 of 2. Here's page 2. And what would be amazing if folks wanted to kind of peruse this entire slide deck before we reconvene tomorrow, and then we can get some updates from the reviewers specifically, and then you can take a look at some of the options. So I'll just kind of sit here for a minute. And I wanted to share that we on the Measure 110 team have been preparing diligently for the OAC meeting that is today. So sneak preview for those of you who will join us again this afternoon, we're spending a lot of time together today, is we heard loud and clear that the OAC has very clear priorities. We already understand that they want to prioritize funding existing grantees and applicants that express culturally specific service provision. There was also a desire to make sure that the priorities that include gender affirming care, folks who cover services that either are not billable by Medicaid or are for individuals who are not covered by Medicaid, to limit service expansion, and to also, whenever possible, only prioritize services directly provided to clients. And so what we've been doing in the background is madly preparing for that conversation. And what that looks like is my understanding, and I think I'll have Keisha and Ron and Morgan or any other OAC members here today articulate that the desire is to help spread the wealth as much as possible, but not so thin that it becomes like, really gross, powdered, soupy, just not even delicious. We want like the hearty soup, but we know that it's not possible to get to. I think about my big canister of powdered bouillon in my pantry, which is, something you need in a minute. But and to use those it's not even a metric, use those numbers as a way to get to a recommended not to exceed amount. So if an applicant is applying for 5 million and we're gonna bring it down to 3 million, it's not that they shall eliminate all of those admin positions or eliminate any new service areas, but this is a new recommended total that they're going to need to build a new budget with, and that through negotiations we can ensure that the service areas are covered and that it is workable, and we get new metrics about how many folks that can serve. So that's the work we've been doing pretty wild in the background to make sure that the OAC has all of the information it needs to make those hard decisions. So I just wanted to call that out and let folks know where we're at with those decisions. And we'll be meeting today from 1:30 to 4:30 to dive into that process. Any other comments or questions for today before we break and join back together again tomorrow to finish up Marion County? Okay. Thank you all. Much appreciation for you. See you next time.